Yes.
Okay. All right, let me show my face so that at least you put face to the voice for people that have not seen Mrs. Ilori like Aja, Zainab. Good evening, everybody. I welcome
Good evening,
you.
Presido.
Thank you, Akwet. Good evening. I welcome all of you to this meeting. This is the second version for week 1. Telecom Innovations for Public Health Practice has been organized by Ave Health Sense, one of our partners in APHPN. I want to thank you for creating time to attend the meeting. I know how busy all of us are. And that shows commitment too on our own part and desire to learn something new. If you recall, during our last meeting in Ilorin, the issue of public health innovations, digitalization of public health interventions came up, and it also appeared in our communique. Then recently, I also attended the PSC Summit, and that the issue of digitalization also came up to strengthen primary health care. So I'm happy that one of our own are the ones. Can you hear me?
Yes, Prof. We can hear you very well.
Oh, fine.
We are hearing you,
I'm
sir.
happy that, okay, good. I'm happy that one of our own, Ave Health Sense, our own Dr. Kene is the one that is leading this. And I want to testify that since APHPN started partnering with Ave Health Sense, so many things have happened positively in terms of what we can see as a result of the partnership. I am made to understand that this series of engagement or meetings will be on throughout this May. And I happen to be the guest of honor for this week. We had a meeting on Wednesday too, and this is the second, number 2 for the week. I must say that APHPN, as it were, we have keyed into what we're going to discuss here today. I want to use one story to key to bed in case I'm not available to give a closing remark. I want to inform that we at the level of APHPN, like you will see during the demonstration session, we already have 2 shops in my wallet shop. And right now, I can confidently say that we are running our secretariat at 0 cost, because the commission we get on a weekly basis up to a month is enough to pay our staff, the admin staff in our liaison office in Abuja, and also to cover some other costs of running the secretariat. So I want to encourage all of us to participate fully and also sign up for my wallet shop, because we as public health physicians, we have to key into the digitalization process. Very soon, we are going to be carrying out some projects that we are handling for ICROC. And we are going to deploy this digitalization process. We are going to work with Ave Health Sense to collect data, especially in hard-to-reach areas of Borno State. So this meeting and this engagement is a win-win for all of us. And I want us to participate, and not just participating, also sign up for the program. So in my capacity as president of APHPN and as guest of honor for this week, I hereby declare this meeting open. Thank you very much.
Thank you, sir.
Thank you, President.
Thank you, President.
Thank you.
So without wasting time, I'll just run through the slides. We intend to spend just 20 minutes. I will spend 10 minutes while the second presenter will do that. Next slide. So, of course, you know my name, Dr. Kene, and the person who is anchoring this, who has brought in the telecom component of what we're talking about today, is the CEO of ViGit Platform International. His name is Joshua Tahula. He will also be at this event to talk about what we're sharing next time. So I'm actually the principal investigator for this project. So what is telecom innovation for public health practice? What is telecom innovation for public health practice? Now, we do know that during COVID, everything changed. And what changed? Those of us that never knew there was anything called Zoom, we introduced to Zoom. And it's very interesting that today we're using Zoom. We struggled with it in the beginning, but that's also happened. While the other industry was struggling, the telecom industry was not. And the reason was that bulk of what was happening was forced away from individuals through the telecom platform. So we have seen evidence. Evidence have shown that MTN made 1.7 trillion naira in 2021. Now, if we have that 1%, if we have 1% of that money circulated among public physicians, that would be a huge amount of money. The same evidence have been shown by Airtel. So the telecom industry circulates money. The only difference is that as public health physicians, we are only using these systems. We are not taking advantage of the fact that these systems give us opportunity to also make use of these resources. Can we off our mic?
Please, can you mute everybody so that we can follow? Please, the host should mute everybody.
Okay, so as I was saying, so what has happened to us essentially is that money move away from us in different directions. The banks take away charges. So for you to get your salary, it must pass through the banks. So whether you like it or not, the bank takes all manner of charges. Insurance takes a lot of funds from us. When you have issues that they're not there. Zoom, by the time we are done with Zoom, Zoom would have taken a lot of your data, all of us seated here, and that data is money to someone else because that person's gave funds by that telecom innovations. Of course, the social media takes both time and money. Of course, the communication we had all today was through WhatsApp. WhatsApp will consume your data, but that translates to money for someone else. Of course, the telecom also does that. So the big question we have asked is the fact that can we now look at this from a very different mindset? The big thing that keeps agitating our mind is innovative financing mechanism. How can this telecom digital cash flow circulate among public health practitioners to enhance quality of their work? Now, what the bank is essentially doing is circulating funds among the industry. So that is the reason why Ave Health Sense, in partnership with ViGit Platform International, has come up with this system that will circulate funds and create a source of income while taking care of your expenses, whether they are personal expenses or they are expenses based in the office. Now, the good thing about it is that we've been test running it for 18 months. This partnership has been there for 18 months. We've been test running the system, and now we are proud that we can share among our colleagues. So I will now call on our colleagues to also discuss that. But let me explain before he comes on board that what is this system called the ViGit system? ViGit is actually an acronym for visualize and get it. So visualize and get result. So we know that with issues of insecurity all over the place, we cannot reach certain facilities. But we also know that in those places, the internet, there's data that we can actually capture data. So the first component of ViGit is designing digital tools for real-time data capturing for key performance indicators, KPIs. And in other situations, we do what we call feed-based monitoring. For instance, if you have to monitor a project in a location where by default you cannot go there for security reasons, you know that people who live there can actually send you data. So we use such individuals as feed-based monitors. So that is the first component of the ViGit system. The second component is the visual top-up automated telecom trading component that have been talked about, where individuals earn 1% of commission weekly, and that becomes the cost recovery system. So if Mr. President was talking about it before now, that the cost recovery system will actually help us do things meaningfully. Now, before now, we've had issues of how do we get a staff in Abuja to manage our office because cost is involved. Now that has been eliminated because of this system. There's also what we call the advanced COMBOPAK basic which we are now using for mini audio telehealth. Now, what it simply means is that we visualize and get people together, and in the course of that, these people are connected and they can talk to each other 24/7, unlimited. So if they talk to each other 24/7 unlimited, it means that they can ask questions when they need to ask, they can consult when they need to consult, they can also get people to support them when they need to support them. Now, this system is automated and financed automatically, so that the people who are making use of it don't really need to be interfered at any point in time. So on this note, I want to invite Joshua, who will now tell us how these components work from the telecom industry, and then how we are using them for the project that we're implementing. So Joshua.
Very good evening, everybody. My name is Joshua Tahuli, CEO Virgin Platform International. I guess you can see my face. Okay, so back to the slides. Now, Dr. Kenneth just spoke about the ViGit system. To better understand the ViGit system for a public health practitioner, ViGit is simply saying that there is so much resources running in the telecom sector. And then the telecom sector knows that money is in people. You are one of the people that the telecom sector look at and know that, okay, with 1,000 public health practitioners that are using 1,000 naira every day, they will make 1 million naira. If you have 1 million of those people using 1,000 every day, that means they are cashing 1 billion naira every day. So ViGit is simply saying that there is a ready-made market here, that so much is going on here, but the public health practitioner is always looking for money to pay salaries, looking for money to run his bills, looking for money to take care of his home and his office expenses. But if he takes advantage of the telecom sector, certainly all these things will be done at no cost. And that is how the ViGit system came about. Now, Virgin Platform, which is the main company that's partnering with Ave Health Sense, is a major partner to the 4 telecom companies, mainly 9 Mobile. So Virgin Platform, as you can see on the screen, is a registered company. The CAC is there for those that want to search, and we are licensed by NCC, the Nigerian Communication Commission for Telecom Business. We're enterprise tech partner, a strategic partner to 9 Mobile. You can see our code there. These things are open just for you to see. And because we have a wallet that people put money, that wallet is converted to stock, which is airtime, the top up to sell, we have to go ahead and get the lending and investment license to make customers feel more comfortable in that area too. Our office is located here in Abuja, $15 Crescent, Wuse Zone 5. We have some other sub-offices in other states. But because we are in the digital space, we make use of the digital space more than the physical office. But here in Abuja, our offices, they run from Monday to Friday. We are also, my wallet shop, which we're going to talk about, is trademarked with Federal Ministry of Trade and Investment and such like. So what is my wallet shop, or what is this platform, or what is this particular digital space that we are providing, or we are offering the public health practitioners to also be part of the resources that go on in the telecom sector? We call it my wallet shop. And what is my wallet shop? My wallet shop is simply an automated VTU trading system. VTU is virtual top-up. One of my bosses, I can say my boss, is the person that brought me into telecom 2014. He was dealing with the physical recharge card. It was a big deal at then with the 9 Mobile, Glow, and the rest. In 2019, when Corona came in March, by April of that year, he was out of business. He called me, said that, Joshua, you were fortunate to have gone into a digital space. For me now, my business has crashed. Why? I cannot sell physical recharge card. I can't move around because of no movement. Everybody has gone to the banking app to buy virtual top-up. Everybody is going to buy a VTU. Nobody is requesting for this physical recharge card. So he was out of business. Or the last time I knew, he was into poultry back in his village, trying to see how he can do agri-business with the little that left. Why am I bringing this story? I am trying to portray that the digital space, which is the VTU, is the main place that is happening in the telecom sector. Billions and billions of transactions take place there. And you are part of the people that spend money on that place. As Dr. Kene was explaining, You are in a Zoom now, you are spending money on data, you make calls, you use other mobile apps that are consuming your time, and you are spending so much on this. We are saying that with the My Wallet Shop, which is an automated trading system for VTU, you can simply just have your own sub-dealer shop. We call it an online shop, and the system will be selling it to the community and to the other corporate organizations that are doing this online now. And whatever profit that is being realized there, a percentage of it is being given to you. Say 1% goes to you every week. So if you have that as your own shop running for your office, that shop will be running and be taking care of your office expense, will be paying your bill for salaries and the rest, just like Prof was explaining. Some of the public health practitioners that have been with them for the past 1 year, they've been taking advantage of that. So that is what My Wallet Shop is. It's just an automated trading system for VTU, which we are saying that get involved and then raise your own expense to run your office at a zero cost. This is just a breakdown of how it works. I'm trying to speed up because of our time. Maybe when we go to question and answer, we can take care of most of the questions. So you get 2% when you buy airtime yourself. Instead of buying it for mobile app, for your own personal consumption, you buy it, you get. And where you want the system to trade for you, you own the shop, and that helps you to take care of your needs every day, every week, and every month. Then we have the second part of it, which is the Combo Basic. The Combo Basic is a product from 9Mobile, one of our major telecom service provider. The Combo Pack is saying that if you are on this plan with your research team, you'll be making calls for free. You will have airtime that you can call other network with just 1,000 naira recharge card. The 1,000 naira is there for you, but as far as you are calling within a team, it is free. And ViGit is saying that, okay, because the free call is there, it takes care of the research, and the airtime that comes in monthly, it also takes care of the research. I know Dr. Kene is going to talk more on that. I just want to dwell on the the telecom aspect of it. And then we are saying that, okay, how do you fund this airtime and the data you are buying for your research team or for your office? That is why My Wallet Shop is there to take care of that. Once you have a shop, the shop takes care of all these expenses. At the end of the day, your shop is doing everything. Your capital is still back to you at the end of the trading cycle, which is either 6 months or 1 year, as you may want. You may select by yourself. And then we are integrated with Flutterwaves and in all banks, and then with the 4 telecom service providers in the country. So it is user-friendly. Once you take advantage of it, you are there. I just want to conclude on this note that whatsoever you are doing now, whether be it a practice, be it a business, be it the office you are running, as far as you do not take advantage of the digital space, sooner or later you will be coming behind and be asking people, how are you succeeding in this sector? Because you have not taken advantage of it. Take advantage of the ViGit system, and all your office expense, including your research and everything, will become seamless and at 0 point. Thank you so much for your time. I will stand by for question and answer when the time comes. Dr. Kene, you can go on.
Okay, so thank you, Joshua, for that wonderful presentation. So the next set of slides, I will simply be talking about how this works. So issues with public health practice. First, there's increased cost with the same salary. Most of us are making so much cost. We're doing a lot of Zoom on a daily basis, and nobody is saying that, look, salary has to increase. There's little hazard allowance. There's inadequate funds for interventions. We have desires. We have good intentions, but funds are not available. There's need for monitoring evaluation. We have talked about that before, and the need for supportive supervision. Now, security risks have actually put us on high alert. For most of us who are public physicians, we do a lot of travels, but this is one thing that is happening to us now. We can't go to those locations that we plan to go. Of course, Zoom and other communication issues have taken away a lot of our resources. So the presentation is essentially a follow-on to what Association of Public Health Physicians issued out as a communique during the last conference in Ilorin, and the emphasis is what role can we play in terms of digitalizing public health, and we shouldn't be asking other people to do it when we have capacity in-house to do that. So that is the reason for which this project was initiated. Next slide. So what is the process assumption? We are assuming that increasing the circulation of telecom funds among public health physicians will improve and enhance the quality of their work. It is based on this formula that technical knowledge to skills minus finance is equal to frustration. So what happens? If we now add finance to it, so if we have technical know-how and skills, and we will now add finance that is available, then we will have exciting opportunities that we can actually implement our project. Next slide. So what is the project strategy? The strategic plan for the project is to have 4 weeks Zoom meeting for training. So every Wednesday and Sunday by 8 p.m. we'll have this meeting. For those who can attend on Sunday, fine. Those who can attend on Wednesday, fine. If you want to attend as many as possible, so be it. We also want to activate my wallet shop for at least 5 members per state. The reason is that I will explain that later. That becomes a cascade so that every branch have at least 5 members who are signed up in this system. Then we're going to conduct digital tool design training for interested states. So if you want us to teach how to design tools, either using ODK or COMBOPAK or any other systems, we have in-house capacity to either do physical training, which you can locate, you come to your place and have a training for your team, or we can do virtual training for many people to participate. We're also going to deploy mini audio telehead for selected institutions. For institutions that wants us to demonstrate this in their hospitals or in their universities or anywhere, we're able to demonstrate that. And of course, we deploy the ViGit system in selected states. So what is the project lifecycle? It's going to be for 6 months. The first May, the month of May, will be actually do Zoom meetings. The whole of May, that's what we're going to do every Wednesday and Sunday. Then we'll activate 5 members per state from May to July. So as states come in, we activate them, explain details. If a state wants us to have personalized training for their team, fine, we can arrange for that. We also design digital tools from May to October. We'll develop, deploy mini audio telehead from May to October. We'll have deployment of ViGit system in select states as a continuous entity. And then of course, by November, we'll do project evaluation. So for those of us who are already participating, we're going to send up a questionnaire during in November to find out how you are afraid about what is your experience during this 6 months. Then we'll now do a project report in December and then make a presentation at the conference in Port Harcourt. So what is essentially the application of my wallet shop in project management? First, there are certain bills that you must not run away from. There is power bills, power supply bills, communication, fuel, office maintenance, pay Zoom. These are necessary expenditures for any project. So what we are saying is that at the end of 12 months, whether you like it or not, these funds will go, they will never return back to you. So if you are spending 10,000 or 15,000 or 20,000 or even 50,000 per month on this, by 12 months, that money will never return back to you. So what are we suggesting that you do with these funds? You simply calculate this and then own a shop that can trade and give you the funds you need to run your overhead. Next. So you estimate the monthly need and then of course put it together, take a shop. At the end of the 12 months or 6 months, as the case may be, your funds are back to you because they are trading and giving you commissions from the commission you are making use of it. So you are practically operating on zero overhead cost. So zero overhead cost operation simply says, look, when sustainability is viewed as being a matter of survival for us, either in business or in public practice, you know what is happening now in the country, then you must look at these options and believe you can create massive change. That is practically possible. And this is why we're looking at this. Now, technology does not reverse itself. I keep saying this at every opportunity. There was a time we're using cameras. Today, nobody's using camera again. Everybody can snap picture anywhere. In fact, so much has happened. So technology will not reverse itself. So what we are doing now is, can we just run this technology? Can we improve on it? So the routine ViGit system is essentially what I've explained before. It combines the ViGit digital tool for monitoring. It combines the auto trading virtual system for cost recovery. And of course, it gives us opportunity to link people to have telemedicine model. I've just explained this before. And so next slide. So what are the benefits of ViGit system? Now it gives you access to clear and accurate data. It is self-financing. It connects you all the time. Of course, it provides an easy flow operation through automation. So most of what is done here is automated. And of course, it offers low cost of operations and several other benefits, including versatile work environment and getting up-to-date accurate data. So any project you are doing, there are potential risks and limitations. So what are the risks and limitations to this project? The first one is change in government policy on the use of virtual top-up. So if today government say, look, you know what, we're going back to paper-based stuff, then we'll now be struggling with V2U automated system. But I don't think that will happen because the banks have actually taken this and have integrated their system. So if there's alteration in the telecom value chain incentives for VTU, so the incentive may change from time to time based on what the telecom decide, which is possible because when COVID was here, they made a lot of money during COVID. So the incentives for VTU were there along the value chain that was huge. But now that they are done with that, these have already changed. And of course, we expect slight changes. There are also issues that if there's policy change on the use of closed user group, so it's not every telecom that is using closed user group. The reason being that most of them are making huge money from data rather than voice. So they are moving away their investment to data rather than voice. So it's possible we may not have any of the before stop using this closed user group. Then there's limitation of network coverage by telecom. So whatever we design is a factor of the coverage of telecom in that location, especially with the telehealth model. Then of course, the rising cost of Android phones and dashboard accessories will also affect part of the project. Yes, okay, so where are we going to get the funds? We're proposing that funds can come from philanthropists to support the digitalized system, budget allocation from state budget. We could have money from international partners to improve quality of efficiency. They will have donors of device from manufacturers or distributors. Of course, we can have health insurance. Next slide. So action plan. Action plan essentially is what you should do after this. First, we expect that every state will sign 5 subscribers, public health physician. The primary health board of various states will offer the audio telehealth we are promoting, and then we'll scale up the model through cycle of influence or respondent-driven sampling. And then some people are already part of this. They can share their experience moving forward. And of course, Telecom will never reverse itself. So this is a test run of what we're doing. So the model simply look at cycle of influence. So we're saying, look, for this project, we don't need 5 people to sign up into the system. And of course, they have the option of signing either people who are working with them or related to them in whatever way, and that can scale up. But for this project, it's for every state to have that. Yes, sir. Now, of course, we know the concept of diversity of innovation theory, which you have early adapters and innovators, early adapters, and early majority and stuff like that. So we are early innovators in this model, and we're expecting that we get early adapters at every state of the association and see how this can be promoted within the system. So this link will be shared in the group. The project is called, the project code is 2010-2480, and the link will be shared in the group for us to click and sign up. Next. So in conclusion, once social enterprises have a diverse and stable set of income stream, they are better placed to have greater social impact. Now, from the last week, before I finally conclude, from the last week, we have 5 people who have already signed up. We have people from Plateau, 2 who have activated, from Plateau State, 2 have activated and 1 have signed up. We have someone from Edo who have equally signed up, and then we have 1 person from Rivers State that have signed up. Now, in terms of the ViGit system, we are having discussions with Adamawa State and then Yobe State. That is where we are with the project. So thank you very much. We can take questions now and comments. The team is supported by Stephanie at the back end and Daniel. So Daniel is always available. And of course, the other team are available to provide support at all times. This is our office location in Abuja. If you want to get in touch, yes, we are available to answer your questions. Thank you very much, everyone. So we can now take questions, right? And then after that, we'll take a demo. So if there are questions now, we can take them. So if you have any question, let us know. Raise up your hand, or you can just unmute yourself and ask.
Okay, thank you so much, Dr. Kene. Can you hear me? My name is Vivian Obonna.
Yes.
Can individuals subscribe? I don't know, because it's like it's for states, the way you have presented it. But can an individual say they want to sign up to my wallet?
Okay, so the first idea is for individuals to sign up as individual public health physicians. That is why we're saying each state will have individuals in the state to sign up as individuals. Now, the second component, which is the ViGit, is the institutional arrangement for states, especially either those who want to run the tele system within the primary health care system or within the general hospital system. But the starting point is for individuals to sign up. And the people I mentioned who have registered actually are individuals. I'm sure you were here last week. They also did last week.
Okay, so as for individuals to subscribe, what do we do? Click on the link.
So the link is there.
How do we progress?
The link is there. You can click on this link. The link is there in the chat box. So you can click on this link. And then if you have issues, you can talk to our team. Stephanie is there. Dan is there. Dan, you can put your number there. And of course, if you want more details on the website, you can also send you the website link. Is it? Yes. Ekpet. Vivian, have I answered you? Hello, Vivian, have I answered you?
Yes, please, thank you.
Thank you very much. So the link is here. Once you sign up, you have, there will be a green page that will appear. That is your thank you page. At the down level, they'll ask you whether you have you have something already. Click on it, put your ID code that is on that green page, and then your password, and it will be active. Dr.
Say that
Akpet,
again, please. Please say that again.
I said, click on the link. If you click on this link,
Yes.
I'm going to demonstrate that. So if
Okay.
you click on this, yes, I will demonstrate that. Yes, Dr. Obaji.
Yes, thank you very much, Dr. Kenneth, for your lecture. Last week, okay, on Wednesday, I joined the Zoom discussion, but I signed up while we were in Ilorin. Since then, I've been enjoying subscription, airtime, and data. But I have a small challenge, and I also told Mr. Joshua this. If I do my telephone, the DSTV subscription, I don't get receipts from them. I know these things are like a utility where you need to get a receipt to show that you are doing a DSTV subscription. I've done that on 2 occasions, no receipt, and I complained to him. He said whether the ICT people will see they are still not working on it. I don't know how long this will come up. And also our own electricity, PHEDC, Calabar, that's Potential Electricity the company, distribution company. Is not on that that list of discourse. I complained this to him. He said they were going to look into it, but up till now, it's still not there. So if I do electricity subscription now, I don't get anything in return. So
Okay,
I should also look at this so that
Joshua will respond to that.
Everything. Okay. Thank you.
Okay, good evening once again, Mr. Obat. First, my apologies for the receipt. I think the delay is actually from me because I had so many things. If not, I sent your request to the IT team to see how you can be generating that receipt to your email instead of, because the receipt is actually in a transaction history. But from what you want it as a utility where you can present in a bank. So I actually sent to them, please, for the last time, once we are done with this Zoom, I will give them a call, one of them, at least the team leader, to ask how far they've gone, if it's possible to be sending that, especially the, how do you call it, the TV subscription to your email in form of an invoice.
Yes.
So you can always get it out in form of an e-receipt. So you can always print out. So the delay is actually from me. I take responsibility and I'm sorry for not getting back to you on that. And the last one you're talking about is the one of the bills, NEPA bills on all states. As I explained to you earlier, so this is a work in progress. Abuja, just electricity, and I think some of the states are not there. But you can see Eko, which is Lagos, and about 7 others or more, they are there. So we are adding them one after another. I explained to you, integrating with state by state is not easy because of the processes and some of the demands that come on ground. So we decide to use the back end, which is Flutterwave, to just leverage on their own integration on the issue of paying NEPA bills. And this is what they have already integrated so far. So we're actually sending the mails to hurry up, if whatsoever is the order, if they can break through and sign up Abuja, Calabar, and just a few other ones that are not there, the states are not there, so that those people too can come on board. That is in the process. It's just that it's something beyond us that we can push. So bear with us on that, but I can assure you that all that on board, it's not all the states that were, those states that were there, it's not all that were there, but they were just integrated one after another. If you go back and there, it's not very easy, as you know, doing business sometimes when government is involved because of the bureaucracy. But we are doing our best to make sure that all the states electricity bill payments platforms are on my wallet shop. So my apologies for not hurrying up the way you think we should. It's just beyond my wallet shop or Virgin platform. But all of the receipts immediately after now, please, it's a promise. I will call IT team on phone to make sure that if it is something possible, let me know. If it's not something, let's design something within our own platform that customers can receive notification, or something that can be presentable to the bank or any other place as a utility bill. Thank you so much.
Thank you, sir. I'm grateful. You're welcome.
Thank you.
Any other question? Okay, if there's no,
Thank
we
you,
can
sir,
now
for
do
the
demo.
presentation.
Let's just do a demo of what
hello,
the
sir.
system look like.
Hello, sir.
Go ahead.
Thank you, Dr. Kenneth, for that presentation, and Mr. Joshua, or the other person that presented. Please, I just wanted to ask for the investment, like individual investment, how much is the minimum, maximum for the investment?
Okay, so
and how does it go?
We're going to do a demo now. You will see it on the page. All those information are on the page.
Okay.
I can see Zainab. Dr. Zainab is here.
Yes,
Thank you,
Dr.
sir.
Kene, I'm listening keenly. I'm smiling to the bank.
Okay.
Well
so we're
done.
going to do a demo now. They will show the system now and do a demo. So, but we're signing in and find a time. So look at the shop categories. You just asked, the list is 25,000 and the maximum is 1M. So if one is actually using 25,000, you get 1% of that, which is 250 naira. 1% of 50,000 is 500. 1% of 100,000 is 1,000. And then 1% of 250,000 is 2,500. 1% of 500,000 is 5,000. You get that per week. And of course, 1% of 1 million is 10,000. We have people who are already on the platform, and if I've used this, you are likely to have gotten this commission on a daily basis. For those who sign up on Wednesday, if you have gotten a shop and activated a shop, by next Wednesday, you've gotten this commission. So we're going to just do a demo now. We'll sign up using any of the accounts available to us. Just click, put 100. Yeah. Okay, so this is, hey, goodness. This is Joshua's account. This is Joshua's account, and in this account, we can see the commission that is here. You can also equally see the money in the virtual wallet. So these systems are automated. So if you are going to fund the system, in such a way that trading is taking place, you will see commission coming here. And of course, the virtual wallet is the wallet that holds your airtime. And we can actually purchase airtime for anybody who is willing to get airtime from us. So just send your number with the network in the chat box. The first 3 people will buy airtime for them, and you will see it happen naturally here. Okay, so the first number here, Obaji. Obaji shouldn't be you now. All right, so we're buying airtime for you. Are you seeing it? So what you are seeing here.
You know, I missed last Wednesday.
You missed that one on Wednesday. So yeah, so he's going to put your number there. He'll copy your number in the chat box. So the first 3 people, and then you see airtime there. Second person is Elizabeth Oko. Okay, so the number is there. The network is MTN and 500. So once that happens, the system asks where the money should be picked. So pick from wallet shop. So you pick from that end. Select virtual wallet. Oh, you want to buy from commission wallet. Okay, so it's buying from commission wallet. So yes, you're supposed to have airtime now. Next one, MTN from Dr. Elizabeth. Yes. Okay, so go ahead and put, that is our number there. Now I can see my Oga. Which one are we giving? Which are we giving now? Okay. 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 Is getting 1,000. Vivian is getting the last one. So there's a number here. It's my Oga's number. So I will load that one now. It is Baba 070. If you receive, let us know that you have received it in the chat box.
Why are you sending 1,000 to some people and 500 to some people? Why?
Because that one, she answered question. Then I'm also sending airtime to my Oga. This one is coming from me, so you will see it on the display.
I have not answered my question.
Size discrimination.
Why are you discriminating?
It's data bias. So confirm.
Why is Elizabeth Oko getting 1,000 and Akpet getting 500? Answer the question.
Okay, apologies. Before the question time, I promised to give 1,000 to the madam that asked the question. So when it got to her, they told me this is her number. That's why I decided to give 1,000. But for that reason, I don't want to be gender biased. I'm going to
give Akpet 500
to make sure that everybody has the 1,000.
Thank you very much, sir.
You're supposed to have received your 500.
I also ask question now.
Gender issue.
There should be gender equality and
Exactly.
equity.
Yes, sir.
Gender equality and gender equity.
So we're equalizing it now. Everybody with 1,000.
Yes,
You're
give
supposed to have
Akpet
received it by now. Let's get
balance of
confirmation.
500.
So I've also sent Organised Baba. I've sent a time from you from a different platform. Different account.
Keneta, since I know you, you have never sent airtime to me. Oh.
Chairman. Ogasa. Me and you. There are so many things we've been sharing together.
But
not airtime.
Okay, not airtime.
All right. So thank you very much, everyone. They've confirmed it's already chat box. The confirmation is in the chat box. So essentially, this is what it is, and this is what we are trying to achieve. So for as many as possible should go ahead and sign up. If we have people who are on the platform that have used this before, this is testimony time. If you want to be courageous to tell our colleagues what experience you have shared in the last 6 months or 1 year, this did not only come from the president. If on the platform and you have had experience with this, let us know. We've been building this for 18 months, and we are committed to making it better and better. And we feel that we should promote it within public health physician, so that we'll have the best of this and experience it and share with others. So thank you very much for your time. Presido, we are done.
Remark.
We are done, sir.
All right, thank you very much. Just by way of closing remark. Are you there?
We are here.
Yes, just by way of closing remark, I want to thank all of you for finding time to attend this session and for the active participation. We can actually deploy this technology even in our local studies, especially in collecting data. So, but for further information, you can get in touch with Dr. Keneta, and as the second aspect of it is, as many people that have listened to this now, they should sign it. And those of you who signed up with small amount of money, if you signed up with small amount of money, your commission will also be small. So Dr. Ahmed, go and upgrade your shop. Your shop is too small compared to your status as head of department. On that note, I want to thank all of you, and I wish you all a very good night's rest and a pleasant week ahead. Thank you.
Thank you, sir. Everyone. Thank you very much.
Good night, sir. Thank you.
Guys, please, thank you very much.
Thank you, sir. Good night, everyone.
Good night.
Okay. Thank you very much, everyone. Awakasedi, thank you very much.
All right, good night. Can I thank you?
Maoga.
Yeah, I want to follow up with you on this on the link to sign up.
Yes.
So that I can get some good shop.
Okay, no issues.
Hello.
Yeah,
It's honestly a good investment. I think it's something worth our while.
Thank you.
Thank you.
Yes, it is.
Thank you very much.
We'll invite you for the M1 general meeting so that you can talk to our members too.
Thank you, Kenneth.
I'm ready.
Yes, once we are ready, we'll let you know.
Okay. Thank you very much. James. Dr. Audu, well done.
Hello.
Thank you, Dr. Kane. Good night.
Dr. Grace, Amadu, long time. Madam Brinkis, thank you very much.
Yes, sir.